Today we'll be covering a two-factor ANOVA with repeated measures on one factor. This is also known as a mixed model ANOVA. Now, in this lecture I'll discuss what a mixed model ANOVA is. Then I'll briefly discuss what we get out of this analysis before I move on to all the assumptions that are part of this analysis. Then I'll perform an analysis, or this analysis, on SPSS using some depression data treatment. And then for the remainder of the lecture, I'll just run through the main analysis and the follow-up test and what they show. So, what is a two-factor ANOVA with repeated measures on one factor? This analysis is very similar to a dependent t-test where you measure the differences within a group over a repeated measure. However, for this analysis, we also analyze the differences between groups, whereas with a dependent t-test, we're only looking at one group and the differences in the means within that group. So for a mixed model ANOVA, we can compare the differences within groups over the time points, so within subject factor, and we can also measure the differences between the groups, known as between subject factor. For this lecture, I'll be using different depression treatments on patient-rated depression scores as an example. Now, in the example, there are three different types of treatments, which are psychotherapy, drugs, and a control group. And then the depression scores will be rated at pre-treatment, so a baseline, and then post-treatment. So in this example, we can see that the between subjects factor is the treatment that the participant receives. So we have three different groups. So we have the psychotherapy, drugs, and control group. And then the within subject factor, we have two different time points, or two repeated measures, which are pre-treatment and post-treatment. A common mistake that people do in a two-factor ANOVA with repeated measures is to forget that time is an independent variable. In this example, the treatment is the method of grouping, so the treatment is an independent variable, and people often forget that there's another independent variable, which is time. So when you have two independent variables, you test for two main effects and an interaction. Now, the main effects just look at the independent variables separately, whilst the interaction looks at both independent variables simultaneously. So we'll be testing for three null hypotheses. The first null hypothesis with regards to grouping or treatment is that there will be no significant differences in depression scores between the groups. And then the main effect for time will be that there is no significant differences in depression scores within the groups over time. And then the interaction will be testing null hypothesis that the differences between the groups is not dependent on time. Now, when we have an interaction, the main effects become irrelevant because both main effects depend on each other for the outcome. So if we have an interaction, we neglect both main effects. Like any other statistical test, we must make sure that all the assumptions associated with the analysis in interest are satisfied before we can perform the analysis. Now, with a mixed model ANOVA, we have four assumptions that need to be satisfied before performing the analyses. And these are that the dependent variable must be a continuous variable, The independent variables must consist at least two categories with related groups. There should be no significant outliers, which is similar to the normality of the data used. We also must satisfy sphericity, and the final one is equality of covariance matrices. Now, for the next couple of slides, I will go through each assumption individually and explain a little bit more about these assumptions. This first assumption is pretty straightforward, really. It's just making sure that the dependent variable is a continuous variable rather than a categorical variable. Now, what I mean by a continuous variable is that it's measured on a scale rather than being categorized. So examples of continuous variables would be age, height, weight, and blood volume. And categorical variables are variables that are categorized. So, for example, blood type, country of birth, gender, or if you're right or left-handed. Now, in the example that we're using, we are looking at patients' rated depression scores. Now, this is on a scale. A categorical way of measuring this would be you either have low, medium, or high depression, but as we need to satisfy this assumption, we are measuring depression on a scale rather than categorizing it. The second assumption is concerned with the variation in group sizes among groups. When measuring differences between groups, it's important that there is not a big variation between group sizes. This is especially important to satisfy another assumption associated with this test, known as the equality of covariance matrices, which I'll discuss later on. Now, the golden rule with regard to group size variation is that the range should be within 1.5 multiplied by the smallest group size. And as you can see, in the example that we have been using, this golden rule has been satisfied because the smallest group consists of 8 participants, and then 8 times 1.5 gives you 12. And in our example, the largest group is 12. So therefore, we've satisfied the assumption that the variation among the group sizes lie in the range of 1.5 multiplied by the smallest group size. So, assumption number 3 is testing that there is no significant outliers. Like any other ANOVA, it's important that the data that we use follow a normal distribution curve. Now, when checking for significant outliers, we're looking for data points that deviate either 2 or 3 standard deviations away from the mean. Now, if we identify outliers, it's then up to the researcher themselves to decide whether or not they want to include those data points or whether to remove them. So, with this assumption, somewhat of the responsibility lies on the researcher whether or not they want to include the outlier or remove them from their data. Okay, assumption number 4 is sphericity. Now, sphericity is quite a complicated assumption to understand, and you use sphericity mainly in a one-way repeated measures ANOVA. However, because there is a repeated measures element to the mixed model ANOVA, we still need to test for sphericity. Now, sphericity is concerned with it's testing for both homogeneity of variance and homogeneity of covariance. Now, we already know what homogeneity of variance is, so it's that the variances at each time point should be similar for each group. Now, homogeneity of covariance is that the correlation between each pair of levels on the repeated measure should be similar. So, in this box on the right-hand side here, I've tried to illustrate how sphericity works. So basically, we want to make sure that the correlation between time point 1 and time point 2 is similar to the correlation between time point 1 and time point 3, and that should also be similar to the correlation between time point 2 and time point 3. So that's homogeneity of covariance. It's that the correlation between each pair of the levels of the repeated measure are similar. Now, because in our example we only have 2 time points, we can assume that homogeneity of covariance is satisfied because there is only one correlation. So we can therefore say that sphericity is satisfied, or we have perfect sphericity, because there's only 2 time points, so there's only one correlation, so that correlation cannot be compared or cannot be similar to any other correlation between time points. So assumption number 4 is to do with sphericity. Now, sphericity is one of the more complex assumptions associated with ANOVAs, and I'll just spend maybe 2 or 3 slides discussing sphericity and how we test for it. Now, sphericity is first introduced in a one-way repeated measure ANOVA, and because we have a repeated measure element to the mixed model ANOVA, we still test for sphericity for a mixed model ANOVA as well. So sphericity is testing for both homogeneity of variance and homogeneity of covariance. Probably you've already covered homogeneity of variance, as it's an assumption of the most basic ANOVA, but simply we're just testing that the variance at each time point are similar. So moving on to homogeneity of covariance, this might be a new concept for some of you. Now, the homogeneity of covariance is testing that the correlation between each pair of levels of the repeated measure should be similar. Now, if you look at the bottom right-hand side of the slide here, this diagram tries to illustrate what sphericity is actually testing for. Now we can see that homogeneity of covariance, it's testing that the correlation between time point 1 and time point 2 should be similar to the correlation between time point 1 and time point 3, and that should also be similar to the correlation between time point 2 and time point 3. So it's making sure that each correlation are similar to each other. However, for our example that we're using, which is the depression data, there is only 2 time points. Now, when you only have 2 time points, that means you only have one correlation, which is the correlation between time point 1 and time point 2. So you can't compare that correlation to any other correlation. Therefore, sphericity is satisfied, and we just assume that we have perfect sphericity. So I'll move on now to a slide which shows you how to test for sphericity and what we do if sphericity is violated. So as I mentioned earlier, when you only have 2 time points where you repeated your measures, you assume that you have perfect sphericity because there is only one correlation, so that correlation can't be compared to any other correlation. So if you have perfect sphericity, you can accept the null hypothesis that there is no significant differences between the variance or covariance within the groups. Now, as you can see in the table, for the significant value, it doesn't give us a value because there is only one correlation, and therefore sphericity is perfect. And you can also see that the correction factors are 1. So if you try and multiply the degrees of freedom by 1, it will still give you the exact degrees of freedom that you started with, because multiplying anything by 1 we'll just keep it at its original value. So for our example, we know that sphericity is satisfied, and therefore we don't need to use any of the correction factors. Assumption number 5, the equality of covariance matrices. Now this is an extension of sphericity. So equality of covariance matrices assume that the covariance matrices are similar between all the groups. So sphericity was introduced for a one-way repeated measures ANOVA, which only has one group. However, when we're doing a mixed model, we're introducing that randomized element to the analysis, which compares the differences between groups. So we have more than one group. So we need to make sure that the covariance matrices are similar between all the groups. And on the next slide, I'll discuss how we test for this in SPSS. The way that we test for this assumption is by the boxes M test in SPSS. Now the boxes M test is testing the null hypothesis that the observed covariance matrices of the dependent variables are equal across all of the groups. Now, as I mentioned earlier, it's very important that the variation between group sizes satisfy the rule that we discussed earlier. And when that rule is not satisfied, it becomes difficult to satisfy this assumption. By that I mean it's easier for us to reject the null hypothesis, which is bad news for this assumption. However, in the example that we've used for the depression data, the boxes M test gives us a significant value of 0.9, which is bigger than 0.5, so we can satisfy this assumption, and we can conclude that there is no significant difference between the covariance matrices between the groups. However, if this assumption was violated, i.e. we had a significant value of less than 0.5, the only possibility that we have is to remove any of the possible outliers that we identified when testing for significant outliers. Now again, this is up to the researcher whether he or she wants to remove these outliers. However, this is the only possible solution if this assumption is violated. So here I've done a quick video tutorial, help guide you through the process of performing a two-factor ANOVA with repeated measures on one factor. Now, after opening SPSS, you need to open your data file. So you do this by clicking on File, Open, and then Data. For this example, we'll use the depression data. Click on that and then click Open. Yes, continue. And then your data will appear on SPSS like so. For our analysis, we'll only be interested in treatment, PAT-pre, which is the patient's rated score pre-intervention, and then PAT-post, which is the patient's rated depression post-intervention. Okay, so firstly we need to click on Analyze, and then General Linear Model, and because this has a repeated measures element to it, we click on repeated measures, and it has two levels. It has pre, which is the baseline, and then it has post, so only two levels. We'll change the name of the within subject factor to time, and then we can add that, and then click define, and now we need to define these levels. So the first level will be the patient pre-assessment. We click on it, and then we click on the arrow to move it to that side. And the second level will be the patient post-assessment, and again we'll click on it and drag it onto that side. Okay, now as it's a two-factor ANOVA, we also need to test for the differences between the groups, so between the depression treatment groups, and so we need to click on depression treatment, and then we'll click on this arrow to drag it into the between subjects factor, like so. Now that's basically it, but for additional information we'll just click on options, and we'll display descriptive statistics, and also we will need the homogeneity tests, and that's all we need. And then after we've done that, we can click OK, and then SPSS will give us an output. Now that's all we need to test for the two main effects and the interaction. I'll run through this output with you in the last part of the lecture. However, while we are on SPSS, I will show you how to perform the follow-up test that you need for a two-factor or a mixed model ANOVA. So you will need two ANOVAs, one-way randomized ANOVAs, to measure the differences between the groups at pre, and another one to measure the differences between the groups at post. So I'll do that now. So again, go down to general linear model, and because we now want to perform a one-way repeated measure ANOVA, or a one-way ANOVA, you need to click on univariate. And again, the dependent variable will be patient pre. Dependent variable will be patient pre, and the depression treatment will be the fixed factor. As a follow-up test, we will use a Bonferroni. So I don't know if you saw what I did there, I'll do it again. So after you put patient pre in dependent variable and depression treatment in the fixed factor, you then click on post hoc here, and you click on treatment, you move that over to the post hoc test for treatment box, and then you select a Bonferroni, continue, and okay, that's all you need for a one-way ANOVA for the patient pre-assessment. And then you've got that output there, those three boxes, and I'll run through those with you. Now we need to perform another one-way ANOVA for post-assessment scores. So again, we go to Analyze, General Linear Model, Univariate. However, we need to change the pre-assessment to post-assessment, and just double check that the post hoc is still Bonferroni. Yep. So we can click Continue, OK, and then it will give you a one-way randomized ANOVA between the subjects for post-assessment. So those are the two follow-up tests that you need to perform to measure the differences between the groups at the time points. Now, another follow-up test that we need to do is we need to perform three repeated measures ANOVA on each of the groups. So we need to test the differences between each time point within all the groups. So for this, we need to split the data file. So we do this by clicking on Data, Split File, and then Organize Group, or Organize Outputs by Groups. And then you need to click on Depression Treatment, because we want to measure the differences within the depression treatment groups. So SPSS is basically splitting the file for us, so we don't have to do three separate analyses. SPSS will do this for all the groups once we've split the data file. So we click on depression treatment, move it to this box, and then OK. So as you can see here now at the bottom, SPSS has split the file by treatment. So we can now go on and perform the follow-up test for within subjects factor. So we click on Analyze, again, General Linear Model, Repeated Measure, and we have 2 time points, correct, and define, already been defined for us. And that's all that we need. No, sorry, we need to click on post hoc, treatments. So again, we're performing a Bonferroni post hoc test on each of the analyses, and that should be it. So, we'll also add some plots in there. So I usually put treatment or time on the horizontal axis and treatment for the separate lines, and then I'll add that into that box and continue. Okay. And then SPSS will then give us 3, ignore this box here, SPSS then gives us 3 follow-up tests. So this follow-up test is for the control group here, as you can see. So it's measuring the differences within the control group. I'll run through the output with you later, all the important tables that you need to focus on. And then it shows the differences between time point 1, so pre-score and post-score within the control group. Then we have the same for the psychotherapy group. And just waiting for the plot here, and same again, the differences between time 1 and time 2. And finally, we'll have a separate analysis for, where has that gone? We'll have a separate analysis for the drugs group here. So these tables are all to do with the differences within the drugs group. So that's basically how you perform a 2-factor ANOVA with repeated measures on 1 factor. I'll run through this output with you now in the remainder of the lecture. Now that you have performed the analysis on SPSS, I will now run through the important parts of the output that you need to analyze in order to find out if there is a significant difference or not, either within subjects or between subjects, or even if there is an interaction. Okay, so the first box that we need to look at is the test of within subject effects. Now this is testing both the main effect for time, but also it's testing for an interaction, because the interaction includes a within element to it, i.e. the time. So as we have already satisfied sphericity, we focus on the upper values that we get in the table. So for time here in the red box, if we go along the top line where sphericity is assumed, we can see that the significance value is less than 0.5. Therefore, we reject the null hypothesis that there will be no significant difference in depression scores within the groups. So from this, we can say that there is a significant difference within groups over time, but we just don't know where they lie. And now in the orange box, that's testing for an interaction, we can also see that there is a significant difference, or we reject, therefore we reject the null hypothesis. So because we have an interaction, we therefore ignore the main effects. However, we still test for them, but we ignore them if we find that there is a significant interaction. So from the fact that we know that there is an interaction, we can say that the differences between the groups depend on time, or we can say that the differences across time depends on which group you are in. Now, even though I said that the main effects are not important anymore because we have a significant interaction, if you still look at the test of between subjects effects box in the output, This is testing for the randomized element of the analysis. That is that there is a difference between the groups rather than within the groups. If we look at the significant value, it is less than 0.5. So therefore, we reject the null hypothesis that there is no significant difference in depression scores between the groups. But however, we have an interaction, so we ignore this main effect, but we still know that it does exist. From our SPSS outputs, we have concluded that there was a significant interaction, and therefore we rejected the null hypothesis that the differences between the groups is not dependent on time. So it actually is dependent on time, or vice versa, that differences across time is dependent on which group you're in. Because now we have this interaction, we need to perform some follow-up tests in order to find where the significant differences lie. Follow-up tests for a mixed model ANOVA are not as simple as just performing a Tukey's or a Bonferroni, because in a mixed model ANOVA, you have both a between subject effect and a within subject effect. So therefore, you can't really just use a Tukey's or a Bonferroni as a post hoc test. What you must do is you must separate the mixed model into its randomized element and to its repeated measures element. So in order to find out where the significant differences lie between the groups, we need to perform two separate one-way randomized ANOVA for both of the time points. So by performing a one-way randomized ANOVA for pre-scores, we'll find out where the significant differences lies between the groups at their pre-depression scores, and you'll then need to perform a one-way randomized ANOVA for their post scores to see where the significant differences lies between the groups at post-assessment. So the one-way randomized ANOVAs find where the differences lies between the groups. Now, in order to find if there's a significant difference within the groups over the 2 time points, we'd use because there's 3 groups, we'd use 3 separate dependent t-tests or repeated measures ANOVA, depending on how many time points you had. If you only had 2 time points, as we did in this example, you'd perform a dependent t-test. If you had 2 or more, or 3 or more time points, you'd use 3 repeated measures ANOVAs. However, I prefer to use repeated measure ANOVAs, so I used repeated measures ANOVAs as you saw in the video tutorial earlier. Now, after you've performed all of those follow-up tests, or for each of those follow-up tests that you perform, you will need a post hoc test to identify where the differences lie. And I recommend that you use a Bonferroni post hoc test, as is a more conservative post hoc test than a Tukey's test. Here we have the 2 one-way randomized ANOVAs testing for significant differences between the groups, with a Bonferroni post hoc test to identify where those differences lie. So on the left here, it's a one-way randomized ANOVA comparing the differences or measuring the differences between the groups at pre-assessment. And if you look at the top table here, for treatment, we can see that there is a significant difference between the groups. Now, according to our Bonferroni, it shows that there is a significant difference between all of the groups, i.e. the control group is significantly different than the psychotherapy group, the control group is also significantly different to the drugs group, and the psychotherapy group is significantly different to the drugs group. Now, moving on to post-assessment scores, if you again look at the top table on the right-hand side here, we can again see that there is a significant difference between the groups for post-assessment. And if we look at the Bonferroni table, we can see that there is a significant difference between the control and psychotherapy group. There is also a significant difference between the psychotherapy group and the drugs group. However, there is no significant difference between the drugs group and the control group, which would suggest that there is no significant difference between taking drugs or doing nothing and its effect on depression scores. This slide is just some figures to illustrate the differences that we just discovered in the two one-way randomised ANOVAs with Bonferroni. Again, at pre-treatment, we concluded that all of the groups were significantly different to each other. However, the figure shows us that the psychotherapy group was significantly less depressed than all the groups, and that the control group was significantly less depressed than the drugs group. For the post-assessment, from the figure, we can see that the psychotherapy group was the only group that was significantly less depressed than all the other groups. There was no difference between the control and drugs group. However, if you compare both these figures at pre-assessment, control and drugs group were significantly different to each other. However, in post-assessment, they're not. And if you look at the figure, the drugs group are actually less depressed than the control group. There perhaps might not be a significant difference between the control and the drugs group, but as there was for pre-assessment and now there's not, we can kind of assume that drugs are actually better than not doing anything, because the drugs are not significant, but they're less depressed than the control, where at pre-assessment they were significantly more depressed than the control group. So the next step is to perform follow-up tests to investigate the differences within the groups, and for this I performed 3 one-way repeated measures ANOVA with a Bonferroni post hoc test. Again, we will read the top line in the tables because Sphericity was assumed, and if we start off with the control group on the left, we can see that there was a significant difference between pre-assessment and post-assessment for the control group. Now, we wouldn't expect to see a significant difference between pre and post for the control group. However, we did for some reason. The psychotherapy group, again, we see that there is a significant difference between pre and post-test, and it's the same story for the drugs group. There is a significant difference within the drugs group between pre-assessment and post-assessment. So again, I've made a slide with some figures on it to illustrate the differences that we've found in the SPSS output. And for the control, psychotherapy and the drugs group, there was a significant difference between pre and post assessment. And we can see that all the groups, all the depression scores within the groups decreased over time. So therefore we can reject the null hypothesis for the main effect for time, that there actually is a significant difference within all the groups. And that's basically it for this lecture. I hope everything was clear. Feel free to go back to some slides that you didn't understand and go through them again, and watch that video tutorial again to help you perform your own mixed model ANOVA on your own data. I hope this lecture helped you.